I'm Mike Royal. I'm the pharmacist of record, the site pharmacist for Washington University, ACTU in St. Louis, Missouri. In high school, I was always good at math and science, but I loved to cook, and I wanted to be a chef. My parents, even though my mother decorated cakes, my parents wanted me to be the doctor of the family. And I really didn't want to be a doctor. So thinking about it, pharmacy seemed to be a good compromise between science, medicine, and cooking because of the science and medicine part. Plus, when I went into pharmacy, we still made things the old way. Ointments, creams, tablets, capsules, suppositories. And that's cooking. So it was a way for me to merge everything. So that's how I got into pharmacy. Moved into hospital pharmacy about the same time, like in 1983, 84, when the first cases of HIV were popping up in St. Louis. Of course, it was called, AIDS, and actually back then it was still called GRID. This group of people that I knew, mostly healthcare professionals, that were dealing with these strange cases, came to me to help with the people with all these medicines. And we ultimately wound up forming a group called St. Louis Effort for AIDS, which is the premier ASO in St. Louis. In '87, when WashU received the grant to form the AIDS Clinical Trials Unit, the pharmacy director came to me and said, "This seems to be your area of expertise, what you're really interested in, and so I'm going to tell you about a position." And so I applied and got the pharmacist position for the ACTU in St. Louis. The Wednesday before Thanksgiving of 1987, put our first patient on study January 5th of '88. And the reason I remember that was the day after my birthday. And have been there ever since. Being so heavily involved with the patient and the side effect management, dose adjustments and all, is, rewarding on a professional level. On a personal level, the earlier protocols, 019, and back then when AZT was just approved, and that really hit me, because I'm on the cutting edge and I'm helping save lives. But still, even back then, getting them on, just one drug was still maybe prolonged a life, and getting to know these people and knowing them as human beings instead of a statistic. Even now at my unit, people come in and say patient number 2199 whatever, and it's like, I don't know numbers. What's the patient's name? What's the person's name? And I think that's, relating people to research instead of subjects to research is, I think, what I enjoy the most about it, and giving a human face to things.